Hi for everybody and welcome back to my channel with a new name, that is Dharya Veda. And sorry for the delayed uploading of a new video, and thank you so much for all the viewers of mine for your wholehearted love. And let's get started with today's topic, that is Pandu Roga, the disease characterized by the pallor and loss of a luster of a skin. So nowadays what we are seeing, the anemia, that is decreased amount of a hemoglobin in a blood, and also the decreased amount of RBCs in our body, is nothing but the Pandu Roga, as mentioned in our classics. And so now we will see that how this Pandu Roga is origin and how it is derived. So what is the derivation of this Pandu Roga? Padi plus Nashini Pandu, that is Padi is the removes, one which Padi is the luster, one which does the nasha of the luster, that is one which removes the luster of a skin, is nothing but the Pandu Roga. How the person looks like after getting affected with Pandu Roga? Ketaki dhula sannibham, that is the dhula, that is dust particle or a dusty soft material present over the Ketaki pushpa. The color is present for that. The dusty material will be present in the body of the whole body skin of that patient. And what are the synonyms this Pandu Roga is called in our classics, or what are the different names we can call it as, like Kamala, Pandu Roga, Lagharaka, Panaki, Kumbha and Alasa. So when it comes to the Kamala, Lagharaka, Panaki, Kumbha and Alasa, we may consider them as a Pandu Roga only, or maybe they are the advanced forms or chronic stages of a Pandu Roga if get it gone like untreated, if it is treated in an improper manner. So next, what are the nidanas, and so how it is caused actually? The nidanas like aharaja nidana. When it comes to the aharaja nidana, kshara amla lavana atyushna bhojana. When a person consumes the corrosive items and amla, that is excessive sour items and salt items and very hot items, it will definitely impair the agni of that person. By that it causes the Pandu Roga. Viruddha bhojana and asatme bhojana. Use of a nishpava, masha, pinyaka, tilataila excessively in our day-to-day food habits will cause the Pandu Roga. It acts as a aharaja nidhanas and viharaja nidanas. So what are the different kinds of habituations which causes the Pandu Roga? Ati swapna, doing the excessive day sleep, that too soon after the eating of a meals. When the firstly divaswapna is contraindicated or should be prohibited in day-to-day activity, and it should be indicated only in a Grishma Rutu, on an exertion of a person or in a diseased condition, because divaswapna is a root cause for many, maybe for almost all the disorders. So soon after having the meals, one should not sleep, even though if a person can't tolerate that the urge of a sleep, then he must wait for 2 hours after eating the meals, and then he need to go for a sleep. If he done a ati divasupna, that is excessive sleep during the daytime, that too after eating the meals, then it will cause the Pandu Roga. And ati vyayama, the excessive exercise done by the person more than his own capacity level, that will cause the Pandu Roga. Ati maituna, the excessive sexual intercourse. Vegadharana, the suppression of a natural urge usually, and especially the special cause is suppression of a natural urge during the sexual act or sexual excitation. The one person is aroused sexually and also he is having the excessive urinatory micturatory urge. If he suppress that micturation urge because of the sexual act, then he will get affected by the Pandu Roga. And next comes the manasika nadana. So what are the mental conditions which cause the Pandu Roga are upahata chetas by the kama, bhaya, krodha, chinta and shoka. The person who very suffered by the kama, that is excessive desire towards any kind of things, and bhaya, that is fear, shoka, the sorrowness or always being so sad, and chinta, by doing the useless worries, and krodha, being very angry over everything, will definitely cause the Pandu Roga. And Purvarupa. So how the patient is going to feel before the manifestation of this Pandu Roga? According to Charaka, Sa pandurogaha ityuktaha tasya lingam bhavishyataha. So when the person is going to affect with the panduroga, the undergoing pathology inside his body will shows these kind of a purva rupa symptoms. Those are hridaya spandhanam, that palpitation. Rauksham, dryness of a skin, hair, nails is going to sin because of the decrease in the Ranjaka Pitta, that is Prajaka Pitta, getting affected by this Panduroga, and decrease in the Rasa, the pure Adya Ahara Dhatu, that is Rasa Dhatu, there will be a Raukshata. Swedha Bhava, the absence of a sweating will be there because of the Ama. Shrama, the mild works also leads to the lot of stress in that person. Fatigue, he will feel very fainting and fatigue. These are the symptoms according to the Charaka in the Purva Avastha the person is going to see. And according to Sushruta, what more our Sushruta Acharya added for that? Tvaksputana, that is cracking of the tvak. Usually in a winter season, nowadays we are seeing that there will be a rukshata in our skin also, and there will be a cracking will be there. That will occur in every kind of a season if the person is in the Purvavastha of a Panduroga. Shrivana, that is excessive spitting he used to have. Gatra sadhana, that is malaise or fatigue he is going to feel. Mrud bhakshana, this is the special character of a Panduroga, or according to Sushruta, but Sushruta is considered it as a Purva Rupa Avastha, but Charaka and all the authors will say that this is a separate kind of a mrud bhakshana janya Pandu. So mrud bhakshana, that is whenever a person or a baby or anybody having the icha towards eating the mud. So that is a main key feature to identify he is going to have a Panduroga. There is a decrease in the hemoglobin amount in his body. So mrud bhakshana icha will be there. Prekshana kuta shotha, that is swelling in the orbit of that person will be there. Vindmutra pitatva, there will be a yellowish discoloration of a urine and the stool is going to see. A vipaka, there will be a loss of appetite and indigestion is going to see. And so now patient came to my clinic in a Lakshana Avastha, in a Rupa Avastha. Now he is having the presenting clinical symptoms. I need to diagnose that. So how should I diagnose in what and all the different kinds of symptoms and the signs the Panduroga is presenting are Karnakshvedi Hatanalaha, that is tinnitus. The Pandurogi, the affected Pandurogi, always hears some noise or some kind of a sound in his ears. So this is a very key feature to identify the Panduroga. Always the sound he is going to have in his ear. Durbala Agni, loss of function of a Jatragni will be there, and he will say that I am feeling very indigested, my motions are not clear, or there will be a very loose motions are there, he will complain that. And sadhana, debility and malaise, the body ache will be there, and debility is very tired and feel like something is holding him very tightly, and or somebody has beaten him so harshly, he will feel the same things. Annadvesha, aversion towards a food. Gatra shula, pain all over the body will be there. How the pain will resembles mrudita, someone is squeezing him like feeling, or unmatita, that is squeezing type of a pain, or a cutting, pricking type of pain he's going to feel. Aruchi, the loss of appetite will be there. Shunakshi kota, swelling of orbit will be there. Haritaha, that greenish discoloration of his eyes, nails and his body. And also easy factor to identify the anemia is we need to see a capillary refilling time, that the person will be very pale and the blood will be very in a decreased amount. We can easily diagnose that. And what are the other kinds of symptoms? Shirna Loma Hatha, the unexpected, unusual fall of a haze is going to take place in a Pandurogi, and he will say that complaints, usually the peoples are, or patients nowadays generation is very caring about the hairs. So he will complain that unconditionally my hairs are falling. And prabhahata, loss of a luster will be there. The person don't see a very attractive look, there will be a loss of attractive look because of the Brajaka Pitta hampering, and also there will be no Rakta. The Rakta is the main key feature for a good skin. So there will be affection of a Rakta, so there will be affection of a Kanti of that particular person or a patient. Shiri Shishira Dveshi, that is he will be hating his hatredness towards the cold articles or a cold weather. Nidralu, there will be excessive sleep in that patient. Stivana, the spitting will be there. Alpavak, he is not interested to talk more or anything. He will be not interesting. He's like irritated very easily, and he's like, okay, for everything he'll say just And next is pindika udveshtana. The cramps in the calf muscles will be seen, and kanta, uru, pada, ruk and sadhana. There will be a pain and a fatigue feel in the kanta, uru and pada. Exertion by climbing the steps. If the person walks, or if he steps out or over the step, then he will feel very exhausted feeling will be there. And these are the different kinds of symptoms the Pandurogi is going to see or feel when we need to diagnose that. So what is the samprapti of this Panduroga and how the etiopathogenesis is going to take place in a body? So let's see now. Nidana sevana, that is the aharaja, viharaja, manasika nidana. Maybe three of them or the two of them or one of them in a very predominant manner a patient done. So what it causes? It causes the pitta dushti. What are the main particular pitta is? Pachaka pitta dushti. First is anything we do in a bad manner, it will directly affect our koshtagni, that is digestive fire. So pachaka pitta dushti will be there. So there will be a indigestion. So next is another pitta is ranjaka pitta dushti. So what we say that in a Panduroga, that is anemia, there will be a decreased hemoglobin amount. So ranjaka pitta does the rasa ranjana. So it will give the color for a rasa dhatu. So it does the ranjana, that is giving coloration. It will convert into rakta. So here the affection of the ranjaka pitta, that is hemoglobin, loss of hemoglobin, there will be a improper production of RBCs will be there. So pachaka pitta dushti leads to the improper formation of ahara dhatu. There will be a hamper of a digestive activity, and ranjaka pitta dushti will be there. So there will be a lack of a rasa ranjana. Raktakshaya is going to take place. So this now by the pachaka pitta dushti, there will be a malarupi rasa dhatu is going to form because of the hampering of the main jhataragni. And by the ranjaka pitta, there will be no coloration for the rasa dhatu, and rasakshaya will be there. That is considered as a mala. And this mala by the vata, pravruddha vata will be there in a body. So that vata will move this mala, that is improperly formed rasa dhatu, and the rasaranjana rahita rakta, that will drag by this vata to the hridaya. It will move the mala into the hridaya. From the hridaya, there will be a presence of a dashadhamani, through which every body is getting a nutrition and the rakta and rasa dhatu for its own nourishment. So it spreads to the drag to the hridaya and spreads to the peripheral region through the dashadhamanis. So now this mala go and take a ashraya in twak mamsa. So in twak mamsa, the mala will be there and react with the shleshma, the local shleshma and brajaka pitta. The skin will be present. In the skin, there will be a brajaka pitta presence will be there. So by that, twak mamsa shrita mala, when it reacts with the shleshma and brajaka pitta, there will be a abnormal varnotpatti. That may be a pita, harita, krishna, shava varna is going to discolor. The discoloration will be there. That is nothing but the Panduroga. And what are the samprapti ghatakas of this Panduroga? We will see now. Those are dosha. When it comes to the dosha, Pittapradhana tridosha will be there. And when it comes to the dusha, the rasa and rakta and mamsa is going to get affected. What are the srotas? Rasavaha and raktavaha srotas. Also the dashadhamanis are going to include. And dushti, the sangha, and vimargagamana, sangha by the ama, presence of ama, that is improperly formed rasadhatu, and vimargagamana, the malarupi rasa is dragged to the hridaya and spreads through the dashadhamanis, is like vimargagamana. Agni, the jatragni, the pachaka pitta dushti, and rakta dhatu agni because of the absence of a ranjaka pitta. And udbhavasthana, where the disease is going to origin actually in amasha because of the formation of the ama there. And sancharasthana, through the dashadhamanis, it spreads to the peripheral region. And Vyaktasthana, tvacha, mamsa, netra, nakha is going to pale discoloration of there is we going to see. And Adhisthana, where actually the disease is going to start, where it is rooted in a hridaya. Roga marga is abhyantara, sadhya asadhyata of the disease is a kruchra sadhya. We can't treat it very easily by the simple medications or simple medications we can treat, but we need some time for this disease to get cured. That's why it is called as a krichra sadhya. So what are the different kinds of a classification our acharyas done? Charaka and Vagbhata done the 5 types of a classification, whereas the Shushruta told only 4 kinds of a classification. As I already mentioned that Shushruta said a mrud bhakshana as one of the purva rupa avastha, or one of the symptom in a Pandu Roga, whereas the Charaka and Vagbhata considered it as a separate kind of a pathogenesis, that is mrud bhakshana janya Pandu. So what are the 5 types or 4 types are? According to Charaka and Vagbhata Shushruta, 4 types are Vaataja, Pittaja, Kaphaja and Sannipataja Pandu, and the extra one that is mentioned by the Charaka and Vagbhata are mrud bhakshana janya Pandu. So we will see now, we need to do the differential diagnosis. We can't treat every kind of a disorder, every kind of a type of a Pandu Roga by giving the same medication, because in Vaataja there will be a Vaataja pathogenesis, in Pittaja, Kaphaja, Sannipataja there will be a different kind of a pathogenesis will be there. So subsiding the particular dosha, we need to differentially diagnose that particular pathogenesis, then only we can give a suitable medications. So Vaataja Pandu, first one. So what are the different kind of symptoms the Vaataja Pandu is going to represent? So first one, Rukshata and Krishna Aruna Varna of Tvak, Nakha, Nayana, Mutra Purusha. This is very important lakshana. When the person is under the Pandu Roga, and that to be a Vaataja predominant, there will be a Vata lakshanas will be there. Rukshata, there will be a dryness of will be there. Krishna or Aruna Varna, reddish or a blackish discoloration of a Tvak, the skin, Nakha, the inner nails, we can say capillary refilling, what I said, Nayana, in a scleral region, Mutra and Purusha is going, that is stool, and the urine is going to discolor in a blackish or a reddish color. And Toda in the body, there will be a pricking pain all over the body. Vaataja is a pratyatmaka lakshana shula, then there will be a severe kind of a pain will be there. Kampa in the body, tremors, that is Chanchala avastha of Vata, so Kampa in the body will be there. Anaha, there will be a distension of abdomen will be there. Next is Shula of a Sharira, as already mentioned, and Shofa will be seen in the body, that is swelling of the body is going to see in the Vaataja Pandu. If the patient is representing these kind of symptoms, then we need to consider it as a Vaataja Pandu. Next are the Pittaja Pandu Lakshana. So how Pittaja Pandu is going to represent its own symptoms? Pita Harita Varna of Nakha, Nayana, Tvacha and Mutra. Yellow color or a greenish discoloration of a skin, nail, eye and the stool and the urine will be there. Daha, because of the Pitta, the excessive burning sensation the patient is going to feel. Trishna, the excessive thirst because of the burning sensation or increased Pitta in the body. Jvara, there will be a fever obviously. Chardi, there will be a vomiting sensation or nausea will be there. Daurbalya, in motion like Daurbalya will be there, the debility of that person is going to seen. Murcha, because of the excessive burning sensation or a hot flashes the patient is going to feel in his body, that's why he will go for unconsciousness. Svedana, because of the Pitta, the excessive temperature, he will sweat very profusely. And Katukasyata will be there. Amla Udgara will be there. The Urgandhya of that Udgara or a body odor or Sveda will be there. Bhinna Varchas, that is loose motion is going to seen. The Chardi and Bhinna Varchas will be there. So very importantly, burning sensation during the digestion. The burning sensation will be there, that to be in a high peak when it will be there. Burning sensation during the digestion the patient is going to feel. And next comes the Kaphaja Pandu. Now Rogis came with complaining these kind of symptoms. So then we need to consider it as a Kaphaja Pandu Lakshana. What are those? Shukla Tvak Nakhanayana Mutra Purusha. Here the discoloration will be in a whitish manner. In Kannada we will say that Bili Kamaniya like condition. And Kapha Praseka, the increased Kapha because of the Kaphaja Pandu. Shvayatu, there will be a swelling. Tandra, drowsiness will be there because of the excessive Kapha. Alasya, Klama will be there because of the Kapha. There will be a laziness and lassitude will be there. Ati Gaurava of the body will be there. The heaviness the patient is going to feel. Shwasa, Kasa will be there. The respiratory discomforts and the cough will be there. Loma Harsha, the horripilations the patient is going to feel. Angasada, the body ache will be there. Murcha, Brahma will be there. And Vak Swara Graha will be there. There will be an obstruction of the speech or any kind of a sounds from his oral cavity or a voice box will be there. Next comes the sannipataja Pandu Lakshana. Sannipataja Pandu Lakshana is like mixing of the symptoms and like it will mix all the symptoms and presents in the patient. So, and it will have some specific features also. Those are not a specific, those are also seen, but it will be in a very severe kind of a manner because of the all the tridoshas will be present. Those are jvara will be there, arochaka will be there, hrillasa will be there, Trishna will be there, Klama will be there, Chardi will be there, especially Hatendriya will be there. The person is not going to feel any kind of sensations because of the Indriyas are going to hamper because of involvement of all the three dosha, and Rasadhatu is not there to nourish the body. Indriyas are not getting any kind of a nourishment. They will go in a Hatavastha, they will be in a off mode. Next comes the asadhyata of a Panduroga. So how the improper irreversible pathogenesis is going to produce, or when a patient or a Vaidya is going to say that we can't handle this case, you can take for upper level of hospitals, or we will try, because one should not treat the patient if we don't have that capacity or we are limit for that. Everyone can't treat every disease, even when it comes to the allopathy or any. I'm not talking about any system of a medicine. Everybody, the particular Vaidya will be very special in handling the particular cases. So one should not touch, like one should not have that overconfidence to treat any kind of a disorder. Some kind of a disorder will never have the treatments. So what are the asadhyata? Where should we say varja of that rogi should be done? If that Pandu Roga is chirotpanna, it is very chronic stage. If the patient is there, you need to try the treatment, but you shouldn't say very confidently, we will treat that. The patient is going to very cure in a days. No, you shouldn't say that. At least you should say that we will try. I will try my level best. Remaining is for God. So chirotpanna, if that Panduroga is very chronic, if patient seen yellow color on every visual thing, in a severe kind of a Panduroga or a Kamala, maybe Kamala, the patient will feel the yellowishness or yellowish color of every disorder. If he seen my hand also, he will see the yellow color. If he seen the mobile phone, he will, any kind of object, visual object, if he seen, he will see only in a yellow color. If that in that condition the patient is there, then you should, it is the asadhyata. And shota in medra, guda, ovary, mainly in the genital regions. If a swelling is there, then one should not treat that patient. It is the asadhyata. That Panduroga can't be treatable. And if the Panduroga is associated with constipation, the severe constipation, not a simple constipation, occurs, if even the motion is occurred, it occur in a small quantity in a green color with the kapha. If that condition is there, you shouldn't touch that patient. And shitilata of a body of that patient, the looseness of a joint is going to feel, he doesn't tolerate any kind of a pain at all, and whitish discoloration will be there. The Shweta Varnata of the whole body is going to seem very fair, the patient is going to turn out, and with excessive Vamana, Mucha and Trishna, excessive vomiting will be there. He oftenly falls to unconsciousness and very excessive thirst is going to feel, that is Pravruddha Pitta Lakshana. If he is there, then it is the asadhyata of that condition. Decreased amount of a blood in that patient. When you will see, right, whitish discoloration, we can't imagine that much fair the patient is going to turn out. That much whitish discoloration will be there, that too due to the considerable amount of a decreased blood. So, and this is asadhyata lakshana. And durbalata of a central portion of a body will be there. He can't tolerate the pain, or he can't able to sit in a proper manner. And swelling will be there in shira, janga and bahu. And vice versa, if the durbalata of a shira, janga and bahu is there, and swelling in the central portion of the body is there, then it is also considered as asadhya lakshana of a Panduroga. One should not treat the patient in overconfidence, or we need to send them in a higher authority, or we need to say for that patient's family that we will treat, but everything is left on a God. Thank you.